Consultations for Health, helping you progress in communication skills to optimise the care of your patients. In this video, we will explain one of the most common communication traps that many people fall into during their questioning, which is using compound and leading questions. To get started, we need to understand the similarities and differences between a compound question and a leading question. A compound question can be described as asking two questions at once, which are connected using and. Compounding is often something we do without thinking. It's most likely to happen when we need to find out lots of information in a short space of time, where misinformation or misinterpretation can lead to a needless line of inquiry. This can lead to wasting time and breaking the patient's trust. An example of a compound question could be, tell me about your medicines and if you've experienced any side effects or allergies. Here, the question is combining what medication do you take and have you experienced any side effects from your medication. As you can see, the questions are related, but they have very different answers. As a result of combining, we indirectly tell the patient we want one answer, and this can discourage the patient from giving us more detailed information. Additionally, a typical patient response will only answer the first half of the question. This occurs because our patients may be feeling stressful and their retention time may be shorter. They are already planning their response to the first question while the second question is being asked. Few people will remember that a second question was even asked, and you'll probably have to ask the question again. When thinking about combining questions, it's often better to ask the two questions separately, potentially as closed questions, as in this case we're trying to find out something very specific. Occasionally, you may have a list of closed questions that you need to ask. It's important you allow time for a response between each individual question. For example, do you use creams? Do you use ointments? Nasal sprays? Eye drops? In each pause, we're allowing the patient to acknowledge, verbally or non-verbally, their response. To test yourself and to see if you've learned the difference, let's look at some scenarios during the information gathering stage of a consultation.
Mrs. Baker, I'm Sam, I'm the dentist here today. How is it that I can help you?
Oh, my jaw is so painful.
Okay, what's been going on there then?
Well, it's been going on for about 2 days, something like that. I mean, my partner made me come in to see you today, but basically it's kept me awake all night. It's so painful.
Okay, right. And tell me a bit about your medications and your dental history.
I don't take any medicines, but I mean, I've had some paracetamol for the pain, but it hasn't worked.
Right. Medical history, any family history or any problems yourself?
No, nothing really.
No, okay. Any fever and chills?
I've definitely felt feverish, a bit hot, yeah.
Okay. Any kind of pus and inflammation?
My gum down here definitely feels swollen.
Okay. You mentioned paracetamol. Have you tried anything else? Did that work?
Sorry, did what work?
So paracetamol or anything else you've tried for the pain?
So the paracetamol didn't work, and I haven't tried anything else now.
Okay, so might be useful for me just to find a bit more about your kind of lifestyle history as well. So how many cigarettes do you smoke a week?
I don't smoke.
Oh, you don't smoke, okay. And alcohol, do you drink alcohol?
Occasionally.
Occasionally, right, okay. You see a dentist every 6 months, does that sound about right?
I think the last time I saw someone was maybe a year ago.
Right, okay. And in terms of dental health, how many fillings do you have?
2 or 3.
2 or 3, okay. Right, well, probably seems sensible now you've mentioned the pain that pop over to the chair over there and we'll have a little look and see what's going on. Is that okay?
Yeah, that sounds good, thanks.
Right, let's go do that.
We hope you've enjoyed this video and we want to thank you for your continued support. We've recently passed 2,000 subscribers and we're excited to make more videos to support your consultation skills development. Make sure you like, comment and subscribe to see our future videos. Don't forget to turn on notifications to be notified of our latest uploads. Thank you again from everyone here at Consultations for Health. And remember, keep practicing.